with the COVID pandemic, of course, vaccinations have, or the use of vaccines in CLL patients have gained even more importance than they already had before. We certainly know that other vaccines have been beneficial for CLL patients, be that pneumococcal vaccines, influenza vaccinations. And so before COVID, before we had this COVID pandemic coming, we did a study at the NIH looking into vaccine responses in CLL patients. What's been known is that vaccine responses are typically somewhat blunted in CLL, so less response than in the general population. And we were interested to study how much influence BTK inhibitors may have on vaccine response in CLL patients. And we did this with two vaccines. One was a hepatitis B vaccine, and the other the shingles, the new Shingrix vaccine, which is a recombinant vaccine. So in contrast to the older live virus vaccine, this is now possible to use in CLL. And is, I think, an important part of helping CLL patients prevent shingles, the herpes zoster recurrence. What we saw is that patients were actually, treatment-naive CLL patients were quite able to respond to the Shingrix vaccine with about 60% response rate. While that's lower than in the general population, I think it's very reasonable to offer this vaccine to CLL patients because that's really good supportive care. Intriguingly, for patients on BTK inhibitors, this response was somewhat lower, ranging about 40% of patients on a BTK inhibitor. When we studied hepatitis B vaccine, which is a vaccine to a virus that most people have not seen before, and so here we study really the first response of the immune system to such a virus. And there, the response rates were quite lower, with about 25% for treatment-naive patients and virtually non-existent for patients on BTK inhibitors. So that hepatitis B experience, the experience with the hepatitis B vaccine may be applicable to what we're seeing now with the COVID vaccines, because this is a new virus that the immune system has not in that form seen before. And so what has come out of the COVID vaccine experience is that patients on BTK inhibitors also have a difficult time to respond to these vaccines. And different strategies here could be considered, such as the booster vaccines that are now in discussion, or in discussion with the treating physician, consideration for some period of treatment interruption. The difficulty with the treatment interruption is that should only be done in patients who are really in stable remission, who have been on BTK inhibitors for a certain period of time, arbitrarily, maybe 6 to 12 months at least. And we don't really know how long we need to stop BTK inhibitor therapy to help with vaccine responses. So ideally, this should be studied in clinical trials. It just has been somewhat difficult to set up such clinical trials because of these vaccines being offered under emergency authorization. With the approval now of at least the Pfizer vaccine in the US and hopefully soon also the Moderna vaccine, it should become possible to really study such questions in clinical trials. And Chris Player in the group has set up a vaccine trial at the NIH where we want to investigate the different strategies to help really get good, robust vaccine response to the COVID vaccines in CLL patients. So if that's something of interest to you, please consider participating in a clinical trial, as I think this will be one way of really learning how to best use vaccine strategies to achieve optimal response in CLL patients.